from the Ministry of Finance and National Planning. Thank you.
Thank you. Controller's Office, you can proceed.
Thank you, Chair. Good morning. Yes, good morning, members of the committee. My name is Jenny Mukua, Director Audit Operations from the Ministry of Finance, sitting in for Controller of Internal Audits.
Thank you. You can proceed.
Good morning, Chair. Morning, members of the committee. Morning, PS and your team. My name is Amasozi Longwe from the Office of the Controller of Internal Audit. Thank you.
Thank you. Parliamentary Clerk, you can proceed.
Thank you, Chair. Good morning, members. Good morning, PS and your team. My name is Leon Hangala from the Office of the Clerk. Thank you.
Good morning. My name is Priska M. Shimalungu from the Office of the Clerk. Thank you.
Thank you, Senior Media. PS and your team. I'm Warren Chishamwambazi, Member of Parliament from Bwanamkubwa constituency, from Ndola district of the Copper Belt, and I'm the chairperson of this committee. PS, I will proceed to allow you to introduce your team.
Chairperson, I'm George Sinyangwe. I'm a permanent secretary.
Thank you. Before we proceed, PS, can I have those 2 seats filled? The officers who come with the PS can take those seats. Please take the seats. They are just seats. Don't worry. Doesn't matter you're behind, you're in front, we'll still look for you. So please, someone to. Thank you. PS, you can proceed.
Chairperson, I'm George Sinyangwe, Permanent Secretary, Minister of Health. Colleagues, introduce yourselves.
Good morning, Chairperson. Good morning, honorable members of this committee and everybody. My name is Madren Balombuta. I'm Director for Policy and Planning in the Ministry of Health. Thank you.
Good morning, Chairperson. Good morning, honorable members of this committee. My name is Raphael Simfukwe, Director of Finance, Ministry of Health.
Good morning, Chair. Good morning, members of this committee. My name is Tumbeko Likezo, Senior Accountant, Ministry of Health.
Good morning, Chair. Dr. Mwira Richard from Chilenje Festival Hospital, Medical Superintendent.
Good morning, Chairperson, members of the committee. I'm Dr. Scott Nglovu, Director Internal Audit.
Good morning, Chair. Good morning, members of the committee. Good morning, PS and everyone. I'm Dr. Matavish Kasemetete, Assistant Director, Human Resource Management and Planning for Ministry of Health.
Good morning, Chair. My name is Kennedy Muluwa from Finance Department, Ministry of Health.
Good morning, Chair. Good morning, members of the committee. My name is Mutesela Abraham. I'm Acting Chief Pharmacist, Ministry of Health.
Please speak up, they can't hear you. We can't hear you. I don't think we can hear you. Maybe switch on that mic. Maybe you can walk to this mic. And Madam, I think you're not also clear. Just walk to this mic so that members know we're here, even for issues of question.
Good morning, Chairperson. Good morning, committee members. Good morning, Chairperson. Good morning, honorable members. My name is Martha Lupia Ziba. I'm from the Ministry of Infrastructure and Housing, and I'm standing in for Director, Preventive and Maintenance Services.
Good morning, Chair. Good morning, members of Parliament. My name is Henry Sinyangwe. I'm the Chief Architect, Ministry of Infrastructure, Preventive Maintenance Department.
Good morning, Chair and honorable members. I'm Peter Musonda from Copper Belt Province, Senior Accountant.
Good morning, Chair. Good morning, members of the committee. I'm Gordon Mutare, Senior Accountant at Ndola Teaching Hospital.
Good morning, Chair. Good morning, honorable members. My name is Gift Shiwamba. I'm from the Saka Provincial Health Office.
Thank you, PS and your team. We welcome you back to this committee. And PS, let me proceed to confer you with immunity in accordance with Cap 12 of the laws of Zambia, which gives you immunity as you make submission or answer before this honorable committee, and also gives immunity to the honorable members. And PS, that immunity is a serious immunity. When we speak about Cap 12 of the laws of Zambia, people sometimes think it's just a way we talk as a committee. It's a serious, it's got repercussions if it's not adhered to, as it were. So I just thought of mentioning that to you, PS, and your entire team, that as you speak and make submission in this committee, you have immunity. So PS, with that guidance, honorable colleagues, they've done a resubmission on infrastructure under paragraph 22, but to proceed with paragraph 23, because we did not tackle paragraph 23 under the Ministry of Health. And PS, as we proceed, I will be giving guidance, because I think we had asked you to make resubmissions, and the other items we would want also you to make resubmissions on paragraph 23. So, honorable colleagues, will proceed with page 1 of their memorandum, which is budget, provision, funding, and expenditure. You can proceed and ask questions on those pages, as it were. Thank you so much. Honorable Wamnyima can proceed.
Chair, before we go to budget and expenditure, I just want to find out from the PS, with the issue to do with Liwanika General Hospital. I think your submission is indicating that Liwanika General Hospital does not have ENT treatment department, equipment, and pediatric as observed by the auditors. Now, in your management letter, you indicated that the ENT was non-functional due to lack of specialized personnel, and the pediatric intensive care was missing some equipment. That was cited in the report. What is the correct position?
Thank you, Honorable Wamnyima. What page is that on Liwanika General? So we just take note that that question has been asked. Okay, PS is that question. Honorable, you come through later. You can PS proceed and answer that question.
I did not hear the second part of the question.
Honorable Wamnyima, can you rephrase?
Chair, let me rephrase the whole question. In this submission, the controlling officer has indicated that Liwanika General Hospital does not have an ENT treatment department and pediatric intensive care unit as observed by the auditors. But in his management letter, he had indicated that the ENT unit was non-functional due to lack of specialized personnel and that the pediatric intensive care was missing some equipment that had been cited on the report. So my question is, what is the true position at Liwanika General Hospital?
So the true position, in fact, generally across the country is that most of our equipment is obsolete because it was procured close to 10 years ago, and Liwanika General Hospital included. In addition to that, we actually do not have sufficient biomedical engineers across the country to allow for adequate maintenance of this older equipment. And again, it's across the country. The good thing is that, and we will be presenting later, is that we have a replacement plan for equipment across the country, and this addendum will be shared, where we'll be doing it incrementally, starting with the central levels first, and Liwanika, being a central level hospital, will be one of those beneficiaries. With that, and with your permission, Chair, I will ask that, with your permission, my colleagues from Western Province weigh in.
Thank you, PS. Western Province, you can switch off the mic. Is that submission from the PS?
Thank you, Chair, and thank you, PS. With Alab, the Acting Provincial Health Director for Western Province. The submission by the PS is as we have on the ground, but maybe just to include one aspect that he hasn't commented on the pediatric ICU. So what we call the pediatric ICU at Liwanika, actually just an improvised room. It's not a standard intensive care unit and lacks equipment as submitted. Thank you.
Thank you, Honorable Daka.
Thank you, Mr. Chairperson. PS, your ministry has got so many challenges, and from the budget provision, funding and expenditure, I've noticed that there was a 31 million unspent amount. PS, as a committee, we don't expect you to have any unspent amount looking at the problems that your ministry has. So the committee would want to find out which activities suffered because of this unspent 31 million kwacha. I submit, Mr. Chairperson.
Thank you. Any other question? Is there any? Yes, you can proceed.
Thank you, Chair. It's a very good question. There is an apparent low absorptive capacity. In other words, not spending at the rate that we need to be spending. And these resources were meant for recurrent expenditures. And in suffering, it's aspect of the things we needed to spend on related to recurrent expenditures. One of the major reasons that the absorptive capacity is low is actually to do with late disbursements from the Treasury. And if we look historically over the last 3 years, the disbursements have actually been late over the last couple of years compared to the earlier years. And again, through you, Chair, I would ask respective provinces to actually comment on their specific issues. But the major overriding issue is that of late disbursement of resources. Thank you.
PS, we do understand that there's been a bit of challenges with the fiscal space, and we hear your submission that there's been a late disbursement, but if there's a ministry which is given priority, it is your ministry, because it's anchored on health. And apart from that, you said low absorption, the burning rate for the aforesaid funds is being low by the ministry. Maybe also make us understand what are some of the challenges you are facing as a ministry which can enhance high absorption as and when you have funds, as it were, so that some of these issues can be mitigated. We know the treasury aspect, but we now want also to find out, because if there are ministries which are given priorities, Ministry of Health and these other ministries such as agriculture. So PS, you can proceed and tell us what are some of the issues you are facing as a ministry.
Other than the later disbursement responsible for the apparent low absorptive capacities, other issues include the various processes that we need to go through in order to make some of these procurements. And some of them will include, if we are looking to vary the use of resources because we've identified a need to do the same, and then we only have like a couple of weeks in which to do that. Others have to do with which are in fact important, to do with following the ZPPA rules and regulations. They are very important, but if the money has arrived a bit late, it becomes very difficult to navigate those things. Without digressing, I'll give you a very practical example. We received a lot of money for medical supplies and equipment just 2 weeks ago, and it's good that we received that money. But for equipment, you will need a longer time in order to meet the regulatory capacities and so on and some of the processes. So we've had to ask for permission to use those resources for other things that would equally mitigate our difficult circumstances in the sector. Thank you.
Honorable Mfarari, then Honorable Lungu.
Chairperson,
Controlling officer, you are speaking two things here. You are saying you have low consumption level, or burn rate is low, and you are also saying there is a delay in funding. Which one is which? Because if you say there's delay in funding and you refer to Appendix 1, there's nothing that speaks to your assertion. Two, if you say you have low consumption or burning rate is low, it means you have the money and what you are failing is to consume that money. So which one is which delays the whole process for you to have these monies sitting on your account and the year is ending? And if you have evidence to show that you received money late, where is it?
Thank you. Any other follow-up question? Honorable Luma, you can proceed. Oh, sorry. It was Honorable Lungu, then Honorable Luma, you can proceed.
Thank you, Chair. PS, I think it has been evident, like in Eastern Province, where most of our hospitals, when there is a fault, like in the X-ray machine and the other devices that they use to ascertain our patients, it takes almost a year or a longer period of time to rectify those challenges. Are you telling us that during the time that you are making this budget of the year, don't you put in or allocating some funds to see to it that immediately when there's a breakdown of these machines so that they can be worked on there and then? Because you find that like Chipata General Hospital and the urban hospital, these are patients that are really vulnerable and are being subjected to move from point A to point B. And as you're aware that we are living in a time when resources are very scarce, what is it that you are doing to make sure that this vice will come to an end, other than us subjecting to our already vulnerable people to more critical situation? Again, over the delay of funding to the ministry, what is it that you are doing to the treasury to see to it that this is a very critical ministry, which at all cost funding should not delay to this ministry? I submit, my Chair.
Thank you. Honorable Luma, you can proceed.
Thank you, Mr. Chairman. PS Honorable Daka, representing the people of Chadiza, asked a straightforward question to say which departments were affected. Your response was the RDCs. And Mr. Chairman, when you look at the figure of 31 million and what was released from the Treasury, the 94.851, it means you were funded 100%. And then you had the other 33,390,000. Then you had 127 which came from NIMA. Now, if you say it was late release of the funds of the three, because according to what is before this committee, what was for your RDCs was the 94,872 and the 94,851 was released. So you have 31,302 and spent, and you are saying the reason why the 31 was not spent because the money was released late. So of the three, which one are you referring to? Is it the 94,851 or 33,390 or 127? so that when you provide an answer, probably we can engage Minister of Finance since they are here, so that we can clarify this issue. Because, Mr. Chairman, it could be the minister would want to blame the treasury that the funds were released late, and yet the PS has just told this committee that the rate of absorption by Ministry of Health is an issue. And the people from State House, Honorable Mfalali, has just said, where is the issue? So if the PS can run us through from these three areas, where did you receive these funds late? Where the 31,302,000 is coming from? Mr. Chairman, I submit.
Thank you, Honorable Rumai, for your submission. However, I don't see anyone from State House here. I only have my honorable members on the lighter note. PS, you can proceed. Thank you. With the three questions. Thank you.
So, thank you so much for the questions. On question 1, to say I am saying we have a low absorptive capacity, let me amplify. I said apparent, looking like, but not in real. And I said that 3 times. Apparent implies that it looks like you did not spend. You have got a problem of spending, but it's really you received money in the last months, weeks of the year. So in an ordinary eye or in an ordinary observation, it might look like you are not spending as well as you would, but there is a reason that that apparency is being observed. That's what I wanted to amplify on. Eastern Province, very important question, I must say. Again, it's not only Eastern Province alone. Like I alluded to earlier on, most of our equipment is old and obsolete. And also the other problem that we have is in the past, we are not systematic. We bought equipment from every other vendor. Here is Philips, here is Shimasu, here is whatever. So maintenance has been a headache. And then we are also not smart because we did not have service contracts. Right now, going into the future, when we engage, we are saying it comes with a service contract until the equipment is obsolete, so that we negotiate like that. So when something is broken down, we could have money, but just because of things being odd, you would look on the market, you will never find a spare. It's that's true. Compounded by procedures which are good. We need to follow procedures as a government in order to be prudent in the use of resources, that kind of thing. So even when we do have money, like I've emphasized, just because of the legacy issues, we are not able to maintain equipment in good time, and that's regrettable because our people are suffering. But like I said, we actually have a plan to equip all the facilities, not all the facilities, starting with where we can incrementally, and X-rays, digital, ultrasound, mammograms are part of what we have in our plan. And we can speak to things that have come this year, things that will come next year, and so on and so forth. In terms of what we've done, working with finance when we do not receive money, this is not an exaggeration. There is not a single week we do not write to finance requesting for financing. Sometimes people was whom we offer drugs, equipment, and believe me, some of these debts are as old as 15 years. When we need to deconflict, because if we don't do that, then we are not going to have people to do business with. So that's the other issue. Then the final one, the final one is about over the money that we apparently did not put to use at the end of the year. Where was it coming from? I'll be frank, it will be very difficult for me to actually say the quantity, but most of it is coming from the line of releases.
Thank you, PS. Honorable Mfarai, follow-up question.
Chair, it's not even a follow-up question. The controlling officer has not answered my question. My question to you, controlling officer, and chairperson, we want answers that are precise and to the point so that we can quickly finish our interaction here. My question to him was, though he wants to use the word apparent, that meaning that it looks like. What we are asking direct questions, controlling officer, and would want you to answer direct answers so that we can move. My question to you is, you have referred, we are speaking to your document, you have referred us to Appendix 1 for you not, for these monies that have not been utilized, which is at 1,302,569,000. I mean, kwacha. And you have referred us to Appendix 1 to say this is where we can see that you received the monies very late and so forth. Now my question to you is, in your answer you have said, receiving of money is what is causing these monies not to be spent. I have asked, where is evidence to show that this money came late to your ministry?
Thank you.
Thank you so much.
Before we proceed, PS, Honorable Lumai, what is PS, you can switch off the mic.
Mr. Chairman, just like Honorable Mfalari has submitted, I think I was straight to the point. Mr. Chairman, I told the PS that according to the estimates, 94,872 is what you are supposed to be given under in this year under review, and the Treasury gave you 94,851. The balance was only 21,000 kwacha 251. So you were funded almost 99%. Then you had the 33 million which was brought forward from 2022. Then you had 127,853 which you received from NIMA. Now you have the 31.3 million unspent. So under Appendix 1, everything which is here is retention. 22 August 2023, 22 December 2023. Now the question was simple. From which line amongst these three? 94 from the Treasury, 33 brought forward, 127 received from NIMA. So where is this 31 coming from? Because you have got your Director of Finance can easily help you. Because if you say that it is from the releases, then you make the committee to be at Indian Ocean, will be at sea. So we want to resolve this matter so that we can know where is this problem coming from. So Mr. Chairman, we expect the PS to tell us, to say, okay, from this line, 100%. From this line, 100%. From this line, this is where the 31.3 is coming from.
Thank you. PS, you can proceed with those two questions.
Thank you
and
so
then
much.
we'll love to start making progress.
Thank you so much. For the evidence of later disbursements, I will, with your permission, ask my finance director to speak to that. But I know for sure that we are getting disbursements very late. But the evidence, I will ask her, through your permission, Chair, our finance director to speak to that. Then for the second question from Honorable, which line? It is still from the releases. Even if we are fully funded, it depends on when the money arrives. The funding will say fully funded, 100%. But if 10% of the 100% comes on the last day, then it affects, it's still in that line. So with that, Chair, I...
Thank you. Director of Finance, proceed.
Thanks, Chair. I think from the submission, you would see that out of the 21 million was from the normal funding for the year under review. That was the remainder. Then from the carryovers, I think there must have been a 7. Then from NEMA there was about a 3-point-something million. Just from that.
Please speak through the mic, because yes.
So from the NEMA there was a 3-point-something million. Then from the normal funding, that's 21.2. Then the balance was the one we can say from carryovers. So what actually we did as a ministry to facilitate
You see, Chairperson,
what is the point?
The request to the Director of Finance is for him to provide evidence. I think the explanations we have heard, all we want is evidence to show that monies came into the ministry very late. What we are so concerned, Chair, is this money is too much. 31 million. 31 million. It's a lot of money. And then you have hospitals and provinces that are not funded for one reason or the other, or projects or programs that are not being financed. And then they come here, they're telling us that there is evidence, and there's no evidence on paper. Your responses, I want to speak to your responses. Your response is that this was due to the fact that the Treasury released the funds at the year end, making it difficult to be utilized. If you give me such an answer, or this committee such an answer, we'll ask you to provide proof that this is the money that we received and it came late. This other added whatever we are saying we retained. We have not asked you to say, why did you retain this money? We are asking you to say, why didn't you spend the money? And you are saying the money came late. Provide evidence. There's nothing on paper.
Thank you, Honorable Mparari. Director of Finance, please provide the evidence, your funding slips, just to augment that yes, you received funding late. Do you have those funding slips from the Ministry of Finance?
Yes, thanks, Chair. Yes, I think for hospitals it's very easy because we receive grants. So it's just a matter of who produce evidence for the funding for December, and it will be able to show that all these 21 million came from there. I submit, Chair.
Please, can we have that provided as we are deliberating in this meeting? Honorable colleagues, let's make progress. We want those funding slips to show those dates. Honorable colleagues, we can proceed to inadequate staffing levels. Honorable Umar, you can proceed.
Thank you, Mr. Chairman. PS, when you get to the table here, table 2, you find Livingstone is operating at 50.2%. In your establishment, they are supposed to have 1,515 staff. Now they are only operating with 755 vacant positions. Is a very, very big number. When you get to Lufanyama also, and Ndola, is it Ndola, Chipata Central, you have told this committee that you are engaging Minister of Finance for Treasury Authority. What response has Minister of Finance given you, looking at the abnormal staff levels in Livingstone, Kalindawalo, Chipata Central, Chinsali? What is the response from the Minister of Finance? This is too huge to work with as a ministry.
Honorable Mkumbi, you can proceed.
Thank you, Chair. Chair, in addition, a controlling officer, which category of staff is affected the most? Is it doctors, or do we need bonuses, or you understand better? Chair, I submit.
Thank you. Yes, you can proceed with those two questions. Then I'll come to you, Honorable Lungu. Thank you.
So thank you so much for those are good questions. Just to be general before becoming specific, as a country, we require about 140,000 healthcare workers in order to achieve universal health coverage, where people have got access to health services regardless of where they live, work, and go to school. Right now, we are filled at 78,000 of that 140,000, implying that as a country, we are only at 55%. The bottom line is money. We do not have sufficient resources with which to fuel the entire establishment. The second one, which is a smaller problem, has to do with certain specialized skills. We do not have people trained to do that, and if we attracted people from outside, they would actually be extremely expensive. Coming to the specific question in terms of what we are doing with the Treasury, we ask for more, but they define what they can afford to give us. For example, 2 years ago, they were only able to give us enough resources to employ 3,000 healthcare workers across all the categories. This year, we are employing 4,000. Again, it is informed by availability of resources. And next year, we'll be doing 2,500. Again, informed by availability of resources. So it will really take a long time before the fiscal space would allow for us to actually fill the 140,000 establishment. What we are trying to do in the meantime, and that was not part of the question, but I just want to take advantage and amplify on that, is that we are now engaging what we call community healthcare workers. People who live within the community, we want to train them in multiple skills so that they can actually attend to people at the primary level, and this helps to mitigate issues. And we've been able to demonstrate impact through this process, that the number of people...
You can proceed.
We've been able to demonstrate impact that, for example, in TB, our treatment success is very good. We are diagnosing more people, and antenatal attendance is improving as a result of those interventions. They are not the best, but they are stopgap measures. Thank you.
Thank you, PS. Any follow-up question on this? If not, we proceed. Let's proceed to clinical care diagnostic services, non-functional equipment. Page 5, there is non-functional equipment, which has been highlighted there. I think one question was asked by an honorable member for Nalolo on the issue of General Lewanika. Honorable colleagues, you can proceed and ask questions on that. Thank you. Honorable Muparari, you can proceed.
We'll make a follow-up now on the question which came from Honorable Nalolo. Why do you have a contradiction within yourself? In your management letter, you said the ANT clinic is there, admin department, but it's non-functional. And now you're telling us, no, there is no such a department at Lewanika. Am I getting the right? Yeah. Why are you contradicting yourself? Yes, yeah, I think, Chair, I just wanted to know, because in their management letter, they had indicated that the ANT unit was non-functional due to lack of specialized personnel. And the pediatric intensive care was missing some equipment that had been cited in the report. Now, the question which we are asking was, why are you contradicting? Where did that come from in your management letter? Who indicated that it's non-functional due to lack of specialized personnel. And now you are telling us it's not there.
Thank you. Vice Chair, then Honorable, I think Lungu had indicated, then Honorable Amnyima can proceed.
Thank you, Chair. My question to the PS is that all the listed equipment in his submission are very critical to provision of health care services. So how could we have quality health care services if we don't have such equipment? And then my follow-up question would be, is this the cause of high rate of death in Zambia? I submit, Chair.
Thank you. Honorable Lungu can proceed.
Thank you, Chair.
And before we proceed, Honorable Member, PS, I don't know why today you've left ZAMSA, because your answers here saying there's procurement of an uninterrupted power supply through ZAMSA and procurement process has commenced. So we don't know why you left. Every time you come, we bring them, because it's an auxiliary of the ministry and they procure on your behalf. So eminently it will come to them and they need to give us the way forward. Honorable Lungu, you can proceed.
Thank you, Chair. PS, in one of your submission, you stated that 9 hospitals operated at between 37.6 and 78.8 staff capacity. 37, and this included the vacant position where key positions such as consultants, senior resident medical doctors, senior nursing officers, hospital administrators, and dental surgeons, which were critical for operations of the hospital. When do you think this challenge can be mitigated? I submit here.
Honorable Member, where are you? Which question is on staffing levels? No, we'll pass that. We'll move that one. Anyway, I'll allow you. PS, you can still answer that question. We're on equipment, but PS, take note and answer that question. Honorable Amnyima can proceed.
PS, I just want to find out, considering this continuous breakdown in equipment to the extent where equipment becomes obsolete, do you have an equipment maintenance plan executed every year and budgeted for by the ministry to say this is the routine, whether it's at national level, provincial, and district? If you have such a plan, could you share with the committee? Chair, I submit.
Thank you. And PS, we want a person in charge of the entire equipment at your ministry. The one who oversees, I don't know what you call him or her. They can come and take a seat closer. Maybe where there's the doctor from, is that Chilenge? Maybe we can just step back. The one in charge of equipment, if you are there, they can take that seat. PS, you can proceed with those questions. And also remember, there's a question for staffing levels from Honorable Lungu. Maybe we can tackle the staffing issue, then now look at the ones for equipment. Thank you.
Yeah, for staffing, like I mentioned, the biggest challenge is resources with which to fill positions. But also I mentioned that we also have certain specializations where there are very few people. For example, in radiography, to just get consultants in radiography, it's been very difficult because sometimes we produce maybe 1 per year, 2 per year, that kind of thing, and that's the position. In anesthesia, for example, also we've got big issues. So it's about resources and also availability of people. In terms of answering when we will be able to do that, it's actually aspirational. We have a university, ZACOMS, that we need to strengthen strengthen in order to help us augment the rest of the other universities in coming up with these rare skills so that we can fill some of these positions. I would not entirely say we've got a date to say tomorrow we are going to do that. But to your point, it's very good as a ministry to be proactive and think about a plan. And I will encourage my colleagues that we think about the plan. I will take that as advice so that we look at that in a very proactive way. In terms of the other question that came up, where Honorable was saying we are contradicting ourselves at Lewanika, I think, ENT and pediatric ICU. I think we are not contradicting ourselves. What we are saying is ENT is non-functional for a number of reasons, human resources and equipment. The ICU, for lack of a better word, is functioning, but it's a makeshift ICU. It doesn't have the things that it requires to legitimately function as an ICU, but we are improvising. That was what the indication was. Then there was a question to say, since most of our equipment is obsolete, are we providing quality health services? Obviously, as a result of that position, we are compromised because there are certain things that we would need to do which we are not able to do as a result of lack of equipment. Is it contributing to the high mortality in the country? The determinants of mortality in the country are so many, and obviously if one piece of equipment is not there, it might potentially contribute, but we cannot quantify that. Thank you.
Thank you, Honorable Mfalari, you come, and Honorable Lungu. Yes, I think the question which Honorable Wamnyima asked has not been answered. What is do you have a strategic plan on maintenance of this? I think that's why we called your guy, your gentleman who specialized into that. I also just wanted to find out, we've seen a lot, if not all the provinces here, especially the general hospitals, they have very dysfunctional equipment. I come from the Copper Belt. I see Ndola Teaching Hospital, radiography, computerized tomography, CT scan, X-ray imaging, and so many other. Like my colleagues have mentioned, Eastern Province, Kalindawalo, Chipata General, Lewanika, and Kaoma, Mansa, Geno, Chinsali, Kasama, just to mention a few. We want to understand, because you've submitted that you have been funded money for equipment, and you are looking at the process. You've got 13 days, if not end of the year, and to buy these equipments or to repair some of these equipment, you need those contracts, and they take time to advertise and the processes, and hence you are seeking to vary those funds. How then do you intend to procure these equipments in the coming year if you want to vary the funds which you have now? That's a question. Secondly, we want your director, I don't know what is called, in charge of equipment, to give us a roadmap on this, okay? And what is a strategic plan vis-a-vis maintenance, and also your procurement. You did also make submission that today you have Siemens, you have Philips, you have. How are you moving forward to ensure that you have a consistent brand per se, so that maintenance can also be easy, as it were? I thought to ask that question on that vein, and also your officer to amplify on Honorable Wamnyima's question on the strategic plan. Honorable Mfalari, you can proceed, and Honorable Lungu, but PS, take note of that question.
Chair, I'm still concerned on Western Province. Lewanika General Hospital is one hospital that everyone relies on in that province. I would want to have the management letter that was written. I don't know whether the General has it, where they responded that the machine. Secondly, Chair, if they don't have this ENT clinic or department in Western Province, who was using this equipment that is looking like it's non-functional? ENT treatment chair, an ENT endoscope, and a flexible laryngoscope with light source. Who was using this department? Why did they have to send them there? If there was no one who was interested or who had the capacity to utilize them. And now they're obsolete or they are non-functional.
Thank you. Honorable Lungu.
Chair, thank you very much once more. PS, you elaborated quite well over the staffing of members in some of the hospitals. I'm concerned with the Nyanja Hospital in Sinda. It's the only hospital that we have, and it's a mission hospital. As I'm speaking now, we only have one medical doctor. And you can imagine when this medical doctor maybe is on leave, or you find that there's no one who is in place of him. Is it true that because you don't have sufficient funding, you cannot even give them one or two? Because the nearest hospital is about 30-40 kilometers from Sinda, that is St. Francis. Is it true? Even my people, as I'm speaking now, are listening. Because these people, they want to hear or maybe to get hope from you, PS. Is it true that because you are underfunding, you cannot give them another medical officer? I submit here.
Thank you. Honorable colleagues, progress. I need progress. Honorable Mkumbi can proceed.
Sure, I just want to find out from the PS on Chipata Central Hospital, the CT scan there. What is happening to our people there? And then Karindawara Hospital, where we entered into a service agreement with a particular company for 3 years. Is it taking shape now, or are we getting the services from this particular company? Are our people able to access such services? I thank you, Chair.
PS, proceed with the questions as guided. My question, you are answering it, and your person in charge with the equipment, and the honorable colleagues' questions. You can proceed.
Thank you, Chair. I'll start with the easiest question from Nyanje Hospital. The reason we cannot immediately send somebody there is that we are fearing audit questions because we really need to create a funded position, and it takes time, subject to availability of resources, and then we send the person. When we just send sometimes we misbehave and send people to just go and provide services, but when auditors come, they say somebody is seated on a position they should not be sitting on. But we'll look into that human resource to take care of that, so that we can see what we can do. In terms of ZAMSA, my apologies. They should have actually been here, because a lot of things are border. A lot of things we've discussed also border on the work that they do. In terms of maintenance plan, I'll, with your permission, I'll ask my officer to comment, but I'll still come back and speak in general to that.
Thank you. You can proceed.
Thank you. Thank you, committee.
What's your position?
My name is Kale Ambewe, Chief Medical Equipment Officer. Allow me, Chair, first to just to say this, that much as we have equipment that is in our hospitals that was bought in the years 2005 and it has been old, but I just want to underscore the various achievements that government has done so far
by procuring equipment. And this, I think, this picture, we are not seeing it. We are just seeing the people are complaining. But government has really done a lot to change the face because of the plan that we have put in place to make sure that our hospitals do not have this old equipment. Couple of this this equipment was installed when the populations in Zambia was low, and the utilization is something else. But now the populations are high, and if we talk about equipment now, we should be thinking in a different scope by not having a hospital having one X-ray machine, or in that way we should be having a scope of a hospital, a general hospital, having 2 or 3 X-ray machines. So I would like to first start with Dan. We have projects where under the government and other cooperating partners, we have procured X-ray machines close to 41, and these are in various hospitals that we are replacing. And most of the facilities have received the fluoroscopy, and in the far-flung areas like Mafinga, where Muyombe, where they had to reach, they have this equipment now. We have received ultrasound machines procured under government, as well as our cooperating partners under the World Bank, and it is really changing the scope of how service delivery is happening. We have also received a procurement of CT scan machines. We realize some of our CT machines need to be replaced. We need to overhaul our hospitals, and so the roadmap that we are taking place so far, like 2 weeks ago, we are seeing UTH receiving a new CT scan, Levy receiving a new CT scan, NIMA is supporting. We are going to receive about 7 CT scans across the country in most of our provinces. We received some hospital beds under the procurement of 2022. Not enough. 478 is just a drop in an ocean, because our necessity is like we need to change the furniture in our hospital. Imagine you go in your house and you don't change furniture, it will look something else. So we need to change this scope, and we are planned to procure in a bit as we are funded. Last year we planned to procure about 3,000 beds, but because of physical space we are trying to adjust. In the next year we are trying to get those under the wards to change at least the scope of our hospitals. We received theatre equipment under the project from the World Bank, and most of our theatres right now in all the provinces, at least 5 hospitals in each province received this equipment. Next week they should be receiving the last consignment that was procured. These are anesthetic machines, and this will really help change how we are operating So coming to the question of order, sir. So I don't know.
Yes, Honorable Wamni, what is the point of order?
Chair, we appreciate the work government is doing in procuring new. I think that is not the query. And so we know that the gentleman on the floor wanted to underscore the importance, but we appreciate that. Our concern is that we can't keep on buying new without a maintenance plan. So this, for equipment to become obsolete, is because we have this culture where we should buy a new one. A CT scan, let's buy a new one. As a ministry, do you have a maintenance plan at national, provincial and district level to maintain, service this equipment? I think, Chair, that is what the concern is. Not new equipment, no. We appreciate that. In fact, we appropriate from here. Yes.
Thank you. Thank you, Honorable Wamnyima. PS, I think the question is straightforward. We do appreciate what government is doing, and we are very much alive to that fact. And also other cooperating partners who are coming to our aid, such as World Bank, like you are submitting, Mr. Mbewe. But what we want is, even with that new theater which we received, theater equipment, CT scans, the ones which are coming under NIMA, what is our strategic plan to maintain them? Looking at how our catchment areas have grown, You should have a lifespan. Say the new CT scan can run for so many hours to attend to so many people. Then how do we ensure that it does not break down? We maintain it in a given time, or the stipulated prescriptions or requirements of that machine. That's what we want to understand, because it's not just about building. We are building, these are falling off, we continue building. No, that is what we want you to make submission. You can proceed through the PS.
Thank you, Honorable Chair. I was just trying to face salute, but just as the Honorable Minister, the Honorable MP has said, I think let me continue. So the plan for servicing and maintaining equipment is there, and so far we have contracts that have been signed for the maintenance and servicing at national level. These are laundries, laundries and imaging equipment. The plan is there, and so what it is the plan that is there is the 3-year service plan. So after 3 years, we have to renew that contract of maintenance and servicing in terms of the equipment that we have in our facilities. So just as the Honorable has asked also, when we procure equipment, it comes with warranty. So under that warranty, the equipment is serviced twice a year by the manufacturer authorized agents to make sure that this equipment is up and running. And so those are the strategies that we have put in place to make sure that that is done. So under the provincial maintenance as well, we have our teams that are biomedical engineers that are available at the province and the facilities, but we don't have them adequately because we have small numbers. So the plan to maintain this equipment is there, and we are running contracts for the service and maintenance. The Honorable who had asked to say Kalindawalo and Chipata, the cities, and Dola Central, yes. So for those branded cities that we have, the contractors we have, they are moving, they are actually very active now, because coming from the past, we did not have the funding for the maintenance and servicing of these machines. But government has given us funds and we have allocated. So we do a 3-year plan so that within that 3 years, machines are well maintained. Then after the 3 years, we review the contract, you extend. But machines also have a lifespan. So at the end of its lifespan, we should be able now to say, okay, we are going to remove, decommission, and put in new equipment. What we want, the roadmap, is not to have equipment that is overstaying. Imagine the X-ray machine that we have now, that we have bought in 2005. How many years have they stayed? We cannot expect equipment to work for 20 years and expect us to give us the what. So that's why the plan now is to remove them and make sure that the new ones that are coming, we have a 3-year plan, a 3-year warranty, then afterward we have a plan to preventive maintenance for them. I submit, Chair.
Thank you, Mr. Mbewe. Very well submitted. But the question is, are we doing what we are saying? And do we have that plan? PS. That is what's very, very important. And these members who are here are alive to the fact from the provinces are coming from what is on the ground, because they are the ones who pay for some of those people to go and for a CT scan. No, if no end up CT scan, they give the money to go and they're told it's not working. That's why we are asking, and PS, it should be in tandem. If this equipment will last for 4 or 5 years, let's have a plan after 5 years that decommission. By the time it is not even having faults, one is already coming to now replace. It can still be struggling and working, but you have a new one installed, then you start to transition. That is a plan, PS, we want to hear. And if you have that plan, we want you to share that plan with this committee, so that as we remain, we look at that plan and see that moving forward, Ministry of Health has got a plan on maintenance. And what you submitted before this honorable committee is in public domain. Everybody is hearing. And even as we go back to our various places, I'll go to Ndola Central to see if there's a contract and this equipment is working. Honorable Mkumbi can proceed.
Thank you, Chair.
Yes, Honorable Mfarari, what was the question again?
Chair, usually I don't move if my question is not answered. So my question was very simple. On ENT hospital, clinic, I mean, I have asked that there is ENT treatment chair in Mongu, in at Lewanika Hospital, ENT endoscope and flexible with lighting source. And my question was, in your management letter, your response is here. The matter is outstanding as the necessary equipments are not available. And the management acknowledges the auditor's finding and wishes to inform the office of the Auditor General the unit is non-functional due to lack of specialized personnel. It's here in your own response. So now you are telling me that, or you are telling us that there is no clinic. My question to you is, on the ground there is this equipment that is non-functional. That's one. Two, in your management letter, management response, you have indicated that the clinic is non-functional because of non-specialized staff. But here when you have come to this committee, you are now saying that does not exist. Now my question is, when you are responding to this when you are responding to the management letter, why did you say this is not there because you have no specialized staff? And you acknowledge, I hope you acknowledge that there is equipment sitting at Lewanika Hospital, a hospital that covers the entire province. So where is this coming from? We want to know. I think for me, I'm interested to know where this came from and why you don't have this equipment is sitting there, it's non-functional. What was going on here? I think that was my question, Chair. And I've seen also their response in this submission. They are still saying, no, we want to refer people to UTH. 6 days after independence, we should continue moving people from Mongu to ENT. No, it's unacceptable.
Thank you, Honorable Mukumbi.
Thank you, Chair. Chair, I just wanted to reinforce what you had said. Chair, we are looking at C, and C has to do with clinical care and diagnostic services. Under that, we have non-functional equipment, we have ambulance services, and we have support services. Now, when you look at non-functional equipment, PS, this looks like to be a country problem because it's hinging in all the provinces. They are all mentioned there. It's like you have a lot of offset equipment in all the provinces. According to our colleague out there, I don't know, what's your position, sir? Sorry.
Mbewa, Chief Medical Equipment Officer.
Yeah. He stated that they have a maintenance plan. And the chair said we would like to see it. For me, Chair, I would love that we give you maybe 10 minutes or just 5 minutes to what we can bring that to this committee. We want to see that plan and appreciate what you are doing. Words from you are not enough. We want to see. I'm just looking at this. These appendices here. Where do you even start from looking for it? Maybe we can help the committee in telling us where it is so that we look for it and appreciate your works. Chair, submit.
Thank you. Before there's Honorable Wamnyima, Honorable Lungu and Honorable Daka, before you proceed, before I lose my thought, PS is a non-functional CT scan at Chipata General, and in your submission you've indicated that ZAMSA is in the process of procuring the UPS. Yeah, so I want a status on that because I asked it earlier, but I think it was not answered. So I've just remembered. That's why I think I said ZAMSA needed to give us the process. Is that the same question, Honorable Daka? Okay. Okay, Honorable Daka, Honorable Amnima, then Honorable Daka, if it's the same, can amplify it. Thank you.
Chair, the issue of the maintenance plan is a very serious issue, PS. And when we are reporting that the World Bank, we are buying, we're actually not excited because we know you are buying things you are not maintaining. At district level, I am from Naroko constituency, Naroko district. I have not seen a plan at district level of how that equipment is maintained. Even from Western Province, he is here, the PhD. Let him tell me what plan he uses. So this issue of saying we have this plan, we want to see it. A national plan of how equipment should be maintained, provincial and district. If it's not there, just say it's not there. We take it as a recommendation. To tell us, no, we have 3 contracts. Who are those that you contracted to be maintaining? You invite more questions. Who are they? Those that maintain after the warranty is finished. Who are they? And do they have reports to show how they've been maintaining province to province?
Thank you, Honorable Daka.
Thank you, Madam, Mr. Chairperson. PS, I'm making reference to the situation of CT scan at Chipata Central Hospital. Permanent Secretary, it's quite disheartening to note that small things like the UPS, now we even hear about maybe a socket. Now we'll be hearing that a socket has to be procured from Zambia now. Look at these institutions are meant to save lives. And personally, I would like to declare interest because my patients are referred to Chipata Central Hospital only to be told that there's no CT scan, when in fact it's just an electrical issue, not the actual CT scan which has a problem. So want to get to understand the operations of the Ministry of Health now, that even small things now, are they supposed to be subjected to the lengthy procurement system from ZAMSA? Whereas of we have got the mammogram here, the mammograph from the same hospital, and you know how critical this type of equipment is with regards to our mothers. What is it that we have done on a short-term basis to ensure that we insulate such type of challenges that we are facing in your ministry? Should we wait for sure a UPS whilst our people are dying on a daily basis to go and to be procured by ZAMS assured?
Thank you, Honorable. Let's summarize the questions. Thank you, Honorable Daka. I know you are passionate about those things. PS, you can proceed and answer. There is Honorable Mfarari's question, outstanding. Okay, lack of specialized personnel to operate ENT. Honorable Wamnima's question. Honorable Daka, my question is the same. We're talking about this process for ZAMSA on the CT scans battery. PS, you can proceed.
So I will start and then I will ask my colleagues to weigh in, and I will start firstly in general. And forgive me for repeating, most of our equipment is old. For some, we've had maintenance plans related to after-sale maintenance, but so for some, we've not had, and that has been a weakness in the way we've negotiated with the vendors who supply these pieces of equipment. The other weakness has been that we've tended to buy from all over, in the end having a diverse mix that makes maintenance also difficult. Another big issue is we need medical engineers to maintain our equipment. It's been one of the biggest weaknesses, and we discovered this during COVID when we could not even maintain our oxygen plants as a result of not having adequate biomedical engineers. Because even if you have after-sale contracts, you need in-house maintenance to do simple types of things. So we need this cadre, and we've not done enough.
Yes, PS, you can switch off. Honorable Mfarari.
Chair, when responses are being given, controlling officer, don't join in the lamentations. You are just joining in the lamentations. What we expect of you as a committee and as a country, you have identified the weakness in your systems. What have you done? Instead of you joining in the lamentations, this cadre is missing, what have you done? That's the question we're asking. If you have to maintain the infrastructure or the machines, don't come here and start lamenting, say, this cadre we need engineers to maintain. No! What are you doing? You are the chief executive of the ministry. What is the position from the ministry? Because over years we have these challenges in hospitals. Should people continue crying at their funerals about the failure in the Ministry of Health? Give us the solutions that you have at the ministry, not the lamentations. It's unacceptable.
Thank you. PS, it cannot be overemphasized. We want your roadmap. We want the defects. We are here to see how we can, even when you are not there in the house, these members speak on behalf of the places where they're coming from. You've heard Honorable Daka very passionate talking about that Chipata General Hospital. And we are now here talking about the ministry failing to spend 31 million, and we are talking about the UPS. It does not correlate. So we don't want to go into those details. What we want is, what is a roadmap? Where are you failing at the ministry? How do we work together to help you? Even as we recommend, how do we help you as a ministry to improve? So we are not here just to disparade and look at what is not happening. No. Even as we are affected, our relatives, our people from constituencies, we pay for CT scan to go to private institutions instead of Ndola Central Hospital or Chipata Central Hospital, Karindawalo or General Lewanika General. We are having those, we are affected as well. So that's why we want to see where is the problem. How then do we move forward? Yourselves as a Minister of Health and us coming through as lawmakers, even through other avenues, because that way we know that the ministry has got this roadmap. If there's no roadmap, let's start from somewhere to ensure that these issues are mitigated. That's why you see that members of this committee are very passionate and are asking. We are, if my watch takes me right, we are almost spending 1 hour plus on these equipments, because it's very, very important. And if we don't have formidable answers and roadmap, we are not going to move. We need to have a roadmap. We don't want business as usual. We've spoken, we go and sit. Equipment is bought, 1 or 2 is installed there, then we forget. We want to see that even if PS were not here tomorrow, the people will be here. They will come and say, yes, there was a strategic plan for maintenance. Our colleagues who were there looked at it, and what is the way forward? I think that's what we want. With I think that is the position of this committee. PS, we can proceed and critically amplify on that and give us the roadmap. Thank you.
So thank you so much. In fact, I was giving the context, because I believe you start speaking to solutions while articulating the context. I was not trying to avoid anything. I was actually coming to that. And in terms of way forward after that context, like Kalea articulated, we have a replacement plan for the pieces of equipment that we need, and the replacement will have to be incremental, like I mentioned. Couple of things we are doing alongside that. We are ensuring that for the new equipment that we procure, it comes with maintenance plans, and I have a couple of documents that speak to that. Here is the plan for this year going into next year, and like I said, we are ensuring that we have a maintenance plan with the suppliers. We also must have a plan for in-house maintenance. I actually do not agree with my colleague that we have had maintenance, what I call unstructured maintenance plans, where it is related to how you negotiate that kind of thing. But what we need going into the future is to structure it so that embedded in that the supplier maintains, and then we've got in-house when we retire equipment and so on and so forth. If we are looking for that document, we do not have it. We've got sporadic sort of arrangements, and we need to work on that. And colleagues, take note, we need to work on that. The other one had to do with non-functional across the country. The Honorable was right, we've articulated that. Chipata, just a power supply unit, Dr. Ngambi, with permission from Chair, do you want to comment? Because I agree with the members of Parliament that we give grants, and yeah, one piece of equipment, small as it is, should not hold us. Thank you.
Thank you. Dr. Ngambi, can explain there. And also I want Okay, we'll come to this issue later. Let's first have an explanation. Dr. Ngambi, you can proceed through the PA.
Thank you, Chairperson, and thank you, PS. Honorable Daka, thank you for highlighting that concern. And Chairperson, I think that from where we sit, because we are at the service delivery point, I just want to say that we do regret the inconvenience on our rural people, especially. You know, the cost that our people need to go through to access services is unacceptable, especially to us, because this is our commitment to provide quality health services to them. But in terms of this particular equipment, I just want to assure the Honorable Member for Chadiza that we are looking into it. The UPS under question is not the standard UPS we are talking about. It's a specialized UPS. At the last memory, if my memory serves me correct, it's a $50,000 unit, and it is meant to be procured under the current circumstances. It is meant to be procured through ZAMSA, and these procurement processes have started. Regrettably, have been extremely slow. Hopefully, ZAMSA is here now, Chairperson. We're hoping that we can be assisted through this sitting, that these procurements are finalized. In fact, Chairperson, with your indulgence, just to assure that as a remediation for our people, currently what we will see, Honorable Daka, is that the critical needs at Chipata Central Hospital are assessed by the clinicians, the critical people that need this service, and we provide transport to move them to Mambo District Hospital to get this service. It is at a cost to us, unbudgeted sometimes, but also we unfortunately sometimes must experience a regrettable delay to provide services. But it's not ideal, but this is where we are, Honorable Chairperson. I thank you.
Thank you, honorable colleagues. Just a minute, PS, a minute. Yeah, just a minute. ZAMSA DG is here. The rest of the people haven't arrived, so we break for 5 minutes tea. We'll come back now to this UPS issue when ZAMSA procurement has come. So let's break for 5 minutes tea, then we'll come back, then we'll continue from where we've left out, and also on the ENT and the management later. Thank you. Let's proceed for tea. Thank you.
Parliament is open to members of the general public who may wish to undertake familiarization tours of Parliament buildings, either in groups or as individuals, or to attend sittings of the House or parliamentary committees. All those wishing to visit Parliament can either write to the Clerk of the National Assembly of Zambia or simply come to Parliament buildings. Upon arrival at Parliament buildings, visitors are required to identify themselves. A passport or national registration card is required for identification purposes. All visitors to parliamentary premises are required to wear smart attire, either office or casual wear. Before gaining access to the galleries, all visitors are oriented and issued with passes by the security department at the Media and Visitors Center. Those whom permission is granted to sit in the galleries will be ushered to the appropriate galleries by protocol officers. Furthermore, visitors are not allowed to take with them into the galleries such articles as walking sticks, umbrellas, briefcases or parcels of any type, newspapers, magazines or cell phones. All such articles must be deposited at the reception desk. Visitors to the galleries are given copies of the order paper which shows the order in which the business of that particular day would be taken. You can follow all parliamentary sessions and committee sittings on GoTV Channel 28, Topstar Channel 5, DSTV Channel 272, Parliament Radio, or like the National Assembly of Zambia Facebook page.
Notice is hereby given to all members of Parliament and the general public that in exercise of the power conferred upon the Speaker of the National Assembly by Standing Order 259 of the National Assembly of Zambia Standing Orders 2020.
procurement yo mulelanda actually nena yumfuira na kuli imwe
Service of public procurement debitor. Sinizio. Be information iliyo nse.
ECDF tuyumfate ipemuno mukabwe mu makololo.
Free education hapa mwandi ni tima vera chapa free education mali still na meaning ya free education.
Sinizio kabla chizungu chanipita.
To us who are just mere members in the community, it's very difficult for us to understand it because we don't know even the procedures themselves, how they do procure.
Na invera kuli imwe sinizio na public procurement.